Riverside Healthcare puts the health and wellness information you need well within reach.
And we are joined on the podcast today by Dana Mercer. Dana Mercer works at the Riverside Health Fitness Center, and she works with Parkinson's patients in what is called the POWER program. And we're going to learn a lot more about that and about Parkinson's. But first, we're going to learn a little more about Dana, who hasn't been with Riverside all that long. She comes to us from first Florida and then Virginia, correct?
Mm-hmm.
And your major in school, you have a master's in?
I have a master's in clinical exercise physiology, and I also have my bachelor's in exercise science.
Oh. And did I get those transitions right from Florida? No, from Virginia to Florida?
No, from Florida South Florida to Central Virginia, and now here in Bourbonnais.
You're going north and west.
Yeah, I am. I don't know. I think
Making
I'm
a
going
funny
in the
face
wrong
about
direction.
It. Well,
it's getting a little too cold.
We're glad to have you. I'm sure the first winter is kind of not a great one, perhaps.
Yeah, it's a little bit colder than I'm used to.
But summer's here now, and
yes.
so you'll get the heat back.
Yep.
But we're going to talk about Parkinson's today, and your education has been in exercise physiology. Is that the right term, or?
Yeah, so as I got into my master's, I went more of the clinical route, working with people with different, or let's just say special populations.
Okay.
People who have cardiac issues, pulmonary issues, people with neurological disorders such as Parkinson's, or people who have had a stroke.
Yeah, so we're going to focus today on Parkinson's disease.
Yes.
And let's first kind of make sure we all know and understand just what Parkinson's is.
Yeah, so Parkinson's is a neurological disease. It affects the central nervous system, which also affects speech, movement, and so on. And it progressively gets worse.
Yeah. Most commonly, I think people see people shaking.
Yes,
and
the tremors.
They associate that with there may be Parkinson's patients that don't shake or some that do very severely.
Right.
So as we've learned, and as you're going to talk about, exercise can play a role in helping the progression of the disease. Is that accurate?
Well, it actually can help decrease the progression of the disease.
Okay.
So it can help. It won't take the tremors away or anything like that, but it will help lessen the severity of the disease.
Yeah. And we'll talk more about specifically the kind of exercise that you do, and if each patient's a little bit different. But just the idea of exercise, regular exercise, helping movement, helping them get a better control of their body. Is that kind of the idea behind it?
Yeah, basically, just how anybody can benefit from exercise. People with Parkinson's can benefit from exercise. I won't get into too much detail, but what we do is we focus on big repetitive movements that counteract the symptoms of Parkinson's. And we can talk about that more later on if you want.
Yeah, great point made there. Everybody can benefit from
Yes.
exercise, right? And I'm a prime example of somebody who could certainly benefit from more exercise. But with a Parkinson's patient, once they're diagnosed, maybe you could talk a little bit about how, typically they go into treatment, and at what point is this something that they should be doing right away? Or is, they want to kind of get settled into some of their other treatment, and then what's the best course of action?
Personally, I would recommend the sooner I get to see you, the better.
Yeah.
When I get to see you, or any physical therapist going through the LSVT BIG program, it will help lessen, like I said, the severity of the decline in the disease. So the sooner that you're moving and you're trying to counteract those awful symptoms, the better.
Yeah. And is there a class setting that the patients, and do you call them patients or clients? Or
I just call them participants, or they're really like family to me.
Oh, that's great.
We've been together for about 3 months now.
Yeah.
It is in a class setting.
Okay.
We meet 3 times a week. We meet Monday, Wednesday, and Friday. But I also have people I meet with one-on-one who can't really keep up in a class setting. They need more specialization, one-on-one. People that are in wheelchairs that have Parkinson's and can't move as well as some of the other people that are in the class. So I do meet with them one-on-one, and they see a great benefit, even though they are in a wheelchair or whatever it may be. That's a little bit different.
So even within the class population, there's probably a real difference of abilities and different stages of disease.
Yeah, definitely. We've got guys in there or gals in there that actually suffer with the tremors a little bit more, or some people that have the smaller gait So they're walking a little bit more shuffled or bent over. Or we have people who's physically they're there, but mentally they're not as, up to par as
Engaged,
everybody
yeah.
else. So in the class setting, we actually do more cognitive exercises. So we're working the brain, not just the body, but we're working the brain and moving. So we're doing multitasking. We're talking really loud because a lot of times in Parkinson's disease, they tend to lower their voice just a little
really?
bit. And a lot of times you won't be able to hear them. So we speak really loud when we do different exercises, such as today for a warm-up, we walked up and down the room yelling, counting 1, 2, 3, as we walked, and that helps even people with a smaller gait. It makes their gait a lot bigger.
Sure.
So it's super interesting to see, and it's really exciting to see the improvements that we have seen
I
already.
can imagine. Now, before we talk more about the class, how might someone get to your class? Are they referred to it by their physician, or how are you getting clients and patients, participants in the class?
Yeah, so it kind of depends. We've had some people referred from physical therapy because physical therapy is right next door to our fitness center. They're actually in the fitness center, so they go through that program and then they come to us. We also have gotten some people from the doctors saying, hey, the fitness center has this program, you should go to it. And other things is just advertising. They see something in the paper about our Parkinson's program and they come in. All they have to do if they have any other questions is contact me from the fitness center and we can get you plugged in. We typically do free class sessions for you to come check out the class and see what it's all about before you kind of dive in.
Right.
So we do offer that.
How long does the class last for the participants? Is it an hour-long class? Or?
Yeah, it's an hour-long class, like I said, 3 times a week.
Yeah. And then once they get to class, as you said, you'll have a variety of folks in different stages of the disease and different abilities, and you kind of tailor it so everyone can participate. Talk about some of the exercise. You mentioned the gait work and walking and kind of shouting to get them talking louder. Talk about some of the other things that you're doing and why you're doing them.
Okay. So I'll talk a little bit about what I'm certified in is Parkinson's Wellness Recovery, or POWER. What that program is, it's actually developed by the same lady who developed the LSVT BIG program, which
what is that?
That's the physical therapy program that a lot of Parkinson's patients go to after they've been diagnosed or whatever it may be. But the same lady who developed the program that I'm certified in. But with this program, it has a little bit more real world carryover. We do 4 basic power moves is what it's called. We do the power up, the power rock, the power twist, and the power up. Again, power meaning Parkinson's Wellness Recovery. But we do those 4 basic power moves. We do them standing. We do them in the chair, but we also do them on all 4s, on our stomachs, and on our backs. So that way we can get around, if we happen to fall onto the floor, how can we get up?
Yeah.
If we're laying, in bed, how can we roll over? Stuff like that. But those 4 basic power moves have a purpose. So the power up really helps with posture, because a lot of times when people get older, but when they have Parkinson's, they tend to have that stooped posture where they're kind of bent over.
I want to sit up straight now. I'm self-conscious of my posture now.
The power rock works on weight shifting. So a lot of times with Parkinson's patients, they have freezing episodes where they kind of get stuck in a position and they feel like they can't move. So with that weight shifting, they learn to transfer their weight from one side to the next, and then get moving again. It also helps with any types of transitioning. We do the twist for working the trunk rotation. So that helps with rigidity, which is like the stiffness of muscles. So that helps with that, or any movement such as closing the door, going to reach for your seatbelt, whatever it may be in that trunk. And then step, obviously we're working on the bigger steps to get over a curve or to get out of a car, little stuff like that. So that's what we use as our base for all of our classes. I typically work on just those power moves on Mondays. Our Wednesday classes are typically more strength-based classes, so we add those power moves plus like the traditional weights that you find in the gym. And then I add those cognitive exercises such as when you step with your left foot, you're going to say a number, but when you step with your right foot, you have to yell out a letter or something like that. Something to make them think a little bit more. And then our Friday class is more working on their gait. We do bicycle exercises because that repetitive movement is really good for people with Parkinson's. So stuff like that is what we typically do in those classes.
And at any time, do you have family members that participate in the classes also?
We don't have them participate. We do have them sit and watch and learn. We have a family or a husband and wife that comes in almost every single class, and the wife is there every single time, and she'll sit and watch.
And her husband is
her husband is the one with Parkinson's. And she's just part of the group like everybody else is, because everybody will talk to her just like she's part of the group as well. So
well, I would guess that some of these folks, when they go home, if they have a family member that's able to help them with these exercises or knows what they should be doing, that would have to be helpful, I would think.
Yeah, exactly. And they kind of get to see that it's a more hands-off program. I'm not there to, okay, let me help you up. It's, okay, you're on the floor. I'll tell you how you can move your leg in a certain position to get you off the floor, but you need to learn how to do this yourself, because what happens if I'm not there or somebody's not there? You do need to learn how to, do that on your own, so that way you can live a better life.
Yeah, absolutely, more independent. It's always great. And do you have a range of ages? This isn't just an old person's disease. I'm sure there are young folks that have Parkinson's as well. So do you have a variety of ages?
Yeah, so the average age for people with Parkinson's is about 60. It's more common in males than females. But in our class, we've got people anywhere from 60 being our youngest right now, to 70s, and I work with somebody who's about 85 years old. So it's really good for anybody, I think, especially as we get older. I think this whole program can be good for anybody.
Yeah. And say the name of the program again.
So our program is called Partners in Parkinson's. But again, I'm certified through Parkinson's Wellness Recovery, so that might be a little confusing.
Yeah. But the name at the Riverside Fitness Center is Partner in Parkinson's.
Yes, Partners in Parkinson's.
And if folks want to try to contact you, how can they do that?
They can either come into the fitness center and ask for Dana, which is myself, or they can just give us a call and, again, ask for me or shoot me an email. I've got business cards or anything at the front desk that they can give out.
Wow. And the program's been going on 3 months, did you say?
3 months. We just started in March.
And are you seeing success stories already in that time?
Yeah, even within the first 2 months, I had an older lady who was on the floor, and she said, okay, I can't get up. How am I supposed to get up? So we did use a chair to assist. 2 weeks later, she can get on and off the floor without a chair, without any assist. She does it on her own.
Yeah, that's great.
That's the biggest and quickest thing that I've seen. But there's other things such as, I'm able to tie my shoe, put my socks and shoes on by myself for the first time in such and such years.
Yeah.
So
wow, that's tremendous.
Yeah.
That again, that independence and allowing folks to be able to do that has to be very rewarding for you.
Oh yeah, I love it.
And certainly wonderful for them as well.
Yeah.
Dana Mercer from the Riverside Health and Fitness Center, we appreciate you joining us.
Of course. Thank you for having me.